Well, the person who designed Indiana's unique Medicaid program may soon be leading national health care policy. Seema Verma is Donald Trump's pick to head the Centers for Medicare and Medicaid Services. And if Medicaid expansion survives efforts to repeal Obamacare, Verma's model, the Healthy Indiana Plan, or HIP 2.0, could spread to other states. About 250,000 people gained coverage under HIP 2.0, but as Side Effects Public Media's Jake Harper reports, it's not working for everybody.
Seema Verma added a conservative twist to Medicaid expansion. Under HIP 2.0, recipients have to make monthly payments, and a missed payment can mean losing insurance. Now, to be clear, if you make less than the federal poverty level, about $12,000 a year, you don't lose insurance entirely. You get bumped down to HIP Basic, which doesn't cover vision or dental and requires copays. But if you're above the poverty line and you miss a payment, you get locked out of coverage for 6 months. Critics say the program is too complicated. Fran Quigley runs the Health and Human Rights Clinic at IU's McKinney School of Law. He works with people who have had trouble with their HIP 2.0 coverage.
And we're still confused about what they're supposed to do. So absolutely, clients are confused about it. It is enormously confusing.
But even if a client does everything right, they pay their bills on time each month, they could still lose coverage because the state and insurers running HIP 2.0 are making mistakes. Alan Wilson drove a semi for 38 years before his health issues forced him into retirement. First, he had heart problems and diabetes. And then, a few years ago, he found out his kidneys were failing.
A lot of my problems started then. You know, I had to come off the road and retire because I wasn't able to drive anymore.
He signed up for HIP 2.0 in 2015 and paid his bills each month. But he says one time when he went to the doctor, they told him, "You're not covered." He says the insurance company, Anthem, told him he missed a payment.
Then my wife would find the receipt and say, "Look, this is when we paid it, this is where we paid it at."
But he says this kept happening. Even after repeated calls to Anthem in the state, bills that should have been covered went unpaid. He and his wife were frustrated. Eventually, they got help from an attorney. Catherine Wood works at Indiana Legal Services, a nonprofit that provides free legal help to the poor.
I see roughly 3 to 4 HIP cases a month. So over the course of a year, I will probably work on anywhere from 35 to 40 HIP cases.
Attorneys with ILS say they've appealed and resolved dozens of cases where the state or insurance companies made mistakes that got people kicked off of HIP 2.0. People sent their payments in, but something went wrong.
Our clients call us frequently very upset and a little bit angry that they have to go through the process of an appeal to get something that they are entitled to that should not have been interrupted.
State reports show thousands of people have been kicked off of their HIP coverage for missing a monthly payment. But if a HIP client actually made that payment, they may not know they can appeal or that they can get help through organizations like ILS. Adam Mueller is Advocacy Director for Indiana Legal Services.
In order for somebody to get to us, they need to know that they have an issue that is a legal issue, and then they need to know they can contact Indiana Legal Services. So I would say that we're seeing only a small portion of what's out there.
The state declined to be interviewed for this story, but advocates like Wood and Mueller say these mistakes are inevitable. HIP 2.0 is a huge bureaucracy, a government organization working with insurance companies, managing thousands and thousands of monthly payments.
Somewhere along the line, our folks end up slipping through the cracks, and the payments are lost, they're not recognized, and we don't know what happens at that point in time. So it could be a human error, it could be a processing error, we just don't know.
Seema Verma and former Governor Mike Pence said monthly payments would get people to engage with their coverage and make more responsible healthcare decisions. But some health policy experts and attorneys working on HIP 2.0 appeals disagree. They argue the payments reduce enrollment, make the program more costly to run, and more difficult for clients to stay enrolled.
So it's exactly the opposite of the small government philosophy. This is just more complicated and more government and more bureaucracy and a huge waste of taxpayer dollars and a huge pain and sometimes physically causing pain to people who need help.
Without the requirement for monthly payments, people like Alan Wilson wouldn't lose coverage. Wilson eventually got on Medicare, but Anthem still hasn't paid some of the bills he accrued when he should have been covered by HIP 2.0. He says he owes about $3,000, and it makes it stressful to go to the doctor. If Anthem doesn't end up paying, Wilson says he has no choice but to file bankruptcy. For Indiana News Desk, I'm Jake Harper.